Today's video, we're going over physical therapy exercises for Pes Anserine Pain. What's up, guys? This is Dan Pope from fitnesspainfree.com. I'm a physical therapist and a coach. We help to make incredible coaches and clinicians through our online courses, communities, and mentoring programs. The goal of today's video is to make you 1% better. All right, so Pes Anserine Pain is a bit of an odd diagnosis. I actually tend to see it quite a bit clinically. I think right now I have about 4 patients with Pes Anserine Pain, which is actually a little bit odd. Problem is, there's very little to no research on how to best treat this, but I see it quite a bit. We generally have some pretty good success with it. So in today's video, we're gonna go over my favorite physical therapy exercises for your patients with Pes Anserine Pain. Step 1 is going to be unloading aggravating movements. Now, for your average sedentary person that has Pes Anserine Pain, this might be walking a little less frequently, sitting in taller seats as opposed to lower seats, reducing the amount of the stairs that you go up and down, or potentially going up with the good side, right, and down with the bad, just to make sure we don't overstress the aggravated area. For your athletes, it's probably gonna be higher level activities that bother them. So things like sprinting, cutting, pivoting, changing direction, jumping might have to be modified or temporarily eliminated in the early stages of rehab so we don't keep provoking this problem. Next, we want to ensure that we're just training the knee and training the hip. Now, you're gonna have these types of exercises in pretty much every type of rehab program for knee pain, Pes Anserine Pain included. The thing is, this video is not about my favorite hip and knee strengthening exercises. If you guys want to check that out, I'll leave a link in the show notes, link in the description. But yes, we do want to start with a few easy exercises for the knee and the hip and slowly increase over the course of time. All right, next I want to talk a little bit about the anatomy of the Pes Anserine tendons, or the muscles that consist of the Pes Anserine. So I want to make sure I don't mess up because I have a Sharpie and I don't want to take a million takes here. But you have your semitendinosus. If you look at the hamstring, kind of comes down just like so. I'm gonna draw this through here, and it goes down to X marks the spot. Next, you have your gracilis, which is kind of in the middle here, comes down the center, right through the X. And last, you have your sartorius, just like so, kind of wraps around, all goes right into this area, okay? Now, a few things about these muscles. So, your semitendinosus is a hamstring muscle. So things like hip extension and knee flexion are gonna train that area. You also have the gracilis and sartorius, which are going to do adduction. And lastly, all these muscles together will resist valgus forces. So when we choose exercises for the Pes Anserine area, we want to choose adduction, adduction exercises. We want to do hip extension exercise as well as knee flexion exercise for the hamstring portion of the Pes Anserine. So essentially, you just want to pick exercise that challenge this musculature, particularly in the frontal plane where the knee has to resist valgus forces.
Pardon the interruption, but I've got something you're definitely going to like. It's an evidence-based cheat sheet on Pes Anserine Pain. All right, I know it's probably not that exciting, but because you don't care about it, you probably don't know that much about it. So I've done the work for you. This action-packed cheat sheet has everything you need to know about Pes Anserine anatomy, mechanisms of injury, prevalence, risk factors, pathophysiology, diagnosis, differential diagnosis, prognosis, and lastly, treatment. What are we gonna do about this problem? My promise to you is I'm gonna catch you up to date on Pes Anserine Pain in under 10 minutes. This cheat sheet is 100% free. I'll leave a link in the show notes in the description. Go ahead and click on that and get to learning. Now, back to your video.
First, we're going to go over some adductor exercises. And generally speaking, I like to perform adductor exercises with the knee straight. When the knee is straight, we're working all the adducts to cross over the knee. When we keep the knee bent, we're probably putting a little bit more stress on the muscles that don't cross over the knee. We're not so concerned about these. And the first one to start with, particularly with those sedentary folks that are not athletes whatsoever, is a standing hip adduction. So essentially, Steve has a band attached to his ankle, and he's got a PVC for balance, and just bring his leg right across the body. If you want to make this more challenging, you can use a harder band, you can step out a little further from the resistance. I actually like cables a little bit better because it's very easy to just change the resistance, and the resistance is much more smooth. It's not easy towards the start and really hard at the end. But I would say, a lot easier to load a band, a lot of folks can take those home, so a good starting exercise. Next, go over Copenhagen planks. So these are phenomenal exercises for the adductors. They're also a little challenging for your older sedentary patients to get into this position. So make sure that you think about your exercise selection before you give this to an older person. But for athletes, they're phenomenal. So the thing about Copenhagen planks, they're very hard. So we want to make sure that we have easy exercise to start with. So what we're gonna do is a Copenhagen plank, and we're gonna start with this top side leg straight, for the same reason we spoke about before. Essentially, we wanna have that leg straight when we're training the adductor. The other piece is that the knee is going to be in front of the bench. What this means is you're getting a valgus force right here. And the problem, and the reason why it's so challenging, is if Steve were to move all the way out this way, that would be extremely hard. But if we have the bench really close to the knee joint, it's not that bad. The other thing we can do is we can use the bottom side leg to assist. So let's have it pop up right here, and essentially Steve can help with his bottom side leg. And as he starts to get stronger and stronger, pain levels go down, he can take that right up. Good, then take a breather. And like I said previously, if you want to make this more challenging, it's very easy to just extend out the lever a little further. So let's take it a little further here, Steve. Very good, and then pop right up. Definitely gets a little bit harder here. And once your athlete is tolerating this really well, we can add some movement. So essentially we can sink the hip down to the floor, come right back up again. And if you have an absolute beast of an athlete, it's very easy to add additional weight by taking this, putting it in the hip, and then doing a few reps. Good, don't tear your adductors here, Steve. Yeah, good job. I also like working the adductors in a 45-degree back extension machine. So essentially, we have Steve set up, and we have the inside leg, bottom side leg is right up against the plate here. His top side leg is free. So as he's laying to the side, your adductor's firing a lot, the leg is straight, so great exercise for those adductors. Want to make this more challenging, we can obviously increase the duration that your patient's holding this, or we can add a little bit of weight. And if your patient is tolerating this really well, let's go ahead and do a few repetitions. We come to the side, and then right back up again. And you can use your bottom side hand in order to help yourself towards the bottom of the motion when it gets really, really hard. But if you have an all-star athlete that can do it without any assistance, obviously, you can just allow them to do it with their body weight. And lastly, we're not gonna make Steve do this, but it's very easy to just hold weight to your chest and do the same exact motion with a little bit of weight to make it more challenging. And if you got this far in the video, it's important that you're not a silly goose and you like this video and subscribe to the channel. All right, we also want to train the hamstrings, right? So a really easy exercise to train the hamstrings. And this is usually pretty well tolerated, even in your older patients that aren't very mobile. It's going to be a bridge with a slide out. So essentially, Steve is going to bridge up, slide all the way out. He's got sliders underneath of his feet. When he gets to the very end range of motion, he drops those hips, brings his legs back in, and repeats for more repetitions. And if your patient is stronger, can handle this pretty easily, or they're not that painful, you can actually incorporate the slide back in. So Steve's doing it right now. He slides all the way back out with his hips in the air, and he brings his heels back to his hips. More challenging than the bridge slide out. Once your athlete is kicking butt on the sliders for their hamstrings, they can move on to a TRX. So essentially you take your athlete, you put your heel into the bottom portion of the TRX here, and the heel is really what's grabbing onto the bottom portion of the TRX. The foot's just resting onto the handle, right? Lying down on their back. And from here, what Steve is gonna try to do is he's gonna perform a hamstring curl, and while he does, he's bringing his hips up and back towards the ceiling behind him, right? Yep, so as you bend those knees, really shoot those hips back and up. Yep, this is actually quite a bit harder than a slider. I'm not gonna be too mean to Steve, take a breather here, but if you have an all-star athlete that needs more load, you can very easily take something like a sandbag or a dumbbell, placed on your hips, you can perform the same exact motion, extending the hips, yep, curling. Steve's got it, dude, piece of cake. So a nice way to make it harder for your athletes. Once your athlete's doing really well with the double leg hamstring curl variations, we can move to single-legged variations. So essentially, single-leg glute bridge with a slide out here. And if you have an all-star athlete that can do both directions, yeah, Steve's got it, you can also advance to that over time. And lastly, if you have access to it, machines like the adductor pull-in, as well as doing a knee flexion, either a seated knee flexion machine or prone hamstring machine are both phenomenal. I just tend to talk about this exercise last because not everyone has one of these in their clinic, or their patients don't have access to this equipment at home either. So if you do have access to it, great exercise idea. So obviously the goal is to start with easier exercises that are well tolerated, and over the course of time, you work way to harder movements. And then lastly, you want to try to start incorporating activities that previously used to hurt. So for your athletes that had a hard time with sprinting, changing direction, all of those things, you need to start working back to those activities, starting with easier variations and working towards harder variations. So for your cutting, change of direction athletes, maybe start with some ladder drills. Once that feels good, work away into shuttle drills. And lastly, we do kind of full-blown sport-specific drills. And for your older sedentary folks, over the course of time, we should start incorporating more step-ups, more squatting, more functional activities they want to get back to for their regular life. All right, so now you know how to pick some great exercise for patients who have Pes Anserine pain. You may not know how to treat the most common form of knee pain, patellofemoral pain. Well, I have just a video for you. It's gonna be living right above Steve's head. Go ahead and click on that link, and we'll go over my favorite treatments for patellofemoral pain.